Thank you, Joan, and thanks to everybody for organising today. Thanks for coming and for having me. It's a real privilege to be here to present some of the work that we've been doing to help increase ME education for healthcare professional students. This work started as part of a research project for my psychology degree dissertation, and now has continued since I've moved to the School of Nursing and Midwifery at Queen's for my PhD. So this won't be surprising to anybody in the room today, but just to set the scene, people living with ME have reported experiences of minimisation and suspicion of their condition by healthcare professionals. Healthcare professionals report a lack of knowledge and a lack of formal teaching on the condition. Some have shown an unwillingness to recognise ME as a genuine illness, while others have reported they're unsure that ME is real. Specifically, healthcare professionals have reported a lack of knowledge on the clinical manifestations, the appropriate management, and the impact on daily living that this condition has. They also report a lack of confidence in diagnosing and managing ME. So, as you can imagine, if a patient with symptoms or a diagnosis of ME attends a healthcare service and is met with professionals who don't have sufficient knowledge or confidence in the diagnosis and management of their condition, how distressing that could be. But encouragingly, medical students and doctors are aware further training is required and have expressed a willingness to engage in such. And I think we definitely see that here with the work the charity is doing with the University of Ulster and Queen's, getting in and being able to educate medical and health professional students. So the first thing we done to try to address this gap was we delivered a virtual reality education session for medical students and healthcare professionals working in primary care. So this was the Discover ME virtual reality education, which if some of you have a chance to try later on, I think we have headsets here with us. It takes less than 7 minutes, and the participant can look around the scene and see animations and hear voiceovers of real life stories of people about what it's like to live with ME. So we had 28 medical students from Queen's and Ulster University and 15 healthcare professionals who worked in a primary care setting complete this. So we got them to complete a measure of their knowledge of ME and empathy towards people living with the condition beforehand. They then participated in the virtual reality scene, and then afterwards we redone those measures so that we could see if their knowledge and empathy changed following the virtual reality education. So as you can see, it did. Pre and post test analysis revealed statistically significant median increases in both knowledge of ME and empathy for those living with the condition following engagement with the experience. So as you can see, knowledge and empathy increased from their pre-test levels to after engaging with the VR. So the findings suggest really that the Discover ME virtual reality experience shows promise as an educational tool within medical education. Another interesting finding from this study was we looked at differences in that baseline knowledge, so the knowledge measure before they engaged in the virtual reality, between our medical students and healthcare professionals, and we found no differences from extreme ends of the scale, from a first year medical student to someone who'd been working in primary care for over 10 years. So it just shows that the knowledge is really lacking throughout the career pathway. So if we can educate our students, it's hopeful that that can move forward with them through their careers. So what next? So that pilot study of the virtual reality education with our medical students and primary care professionals has been published in BMC Medical Education. That QR code just takes you to the paper if anyone's interested in reading more about that. We've also very recently delivered our first education session now with second year nursing students at Queen's University Belfast. And so this expands on the virtual reality to make it accessible to a wider number of people. So this was attended by 200 student nurses. It included online education about the NICE guidelines and NHS guidelines, a lived experience presentation from Rebecca, who is a nurse with long COVID-induced ME, and then the Discover ME virtual reality setting was delivered this time as a video so that a lot of people could watch it at once. And we done the same thing. We got them to complete those same measures before the session and then again afterwards to again see if we could see if the session improved their knowledge and empathy. And again, it did, thankfully. So pre and post test analysis again revealed statistically significant mean increases in both knowledge of ME and empathy for those living with the condition following engagement with the education session. We also asked students this time for some qualitative feedback afterwards. So I'm able to share some really good quotes that we got after this. So we asked them firstly what they liked about the session, and as you can see from reading the quotes, they really appreciated hearing from someone with that lived experience. So that was from Rebecca sharing her experience, as well as the experiences shared through the Discover ME video. So I think it comes across that that was really important for them. Hearing Rebecca speak, she was honestly brilliant and brave. It's nice to hear an actual patient living with ME, very emotive, created a first-hand experience, and very informative and touching. We also asked them how might this learning impact their future practice, because obviously that's the most important thing, how they're going to take this forward in their future careers. And it's very clear that the empathy that they gained and the understanding about that patient experience is something that will really sit with them. So as you can see, more compassion, empathy, understanding, education to fight for the advocacy of the patient. Listening to someone with a condition has made me aware of what to look out for in practice and how to be more empathetic and understanding. I will be more understanding and open-minded of patients who may have this. It's made me more aware of what ME is and how it affects a patient and their abilities. And lastly, to be more mindful of conditions that may not have definitive answers. The patient's symptoms are what they say they are. So I think by broadening out that education, it meant we were able to deliver this to those 200 nursing students. Although the study aspect of this obviously has to be voluntary for research, and it's just you get that with students, if something's voluntary, they're not all going to do it. So this part was completed by 40 of those 200 did the pre and post test and provided their feedback. But we are hoping to do the education session again with the next cohort of nursing students. So we'll be able to increase our numbers and see if the effects still are ongoing there, and hopefully get a research, some research published out of that as well. I think it just shows that, you know, it's not like an overhaul in a curriculum or something like that. It's something quite accessible and short that we can do to deliver to create lasting impacts and increase knowledge and empathy. So thank you very much.